Menopause changes the body, and it does not discriminate. It affects all women sooner or later. And since the majority of your body contouring clients are women, we expect you see a lot of menopausal women. So you need to be prepared to assist them to the fullest. When they come to you asking for help in reducing the size of their belly, what will your plan entail? Well, of course, fat reduction, the 6-in-1 protocols, but there's more. The bone loss associated with menopause also plays a significant role in the belly problem. Think about it. Because of menopausal bone loss, women shrink in height. Well, that leads to a more compact torso with less room for curves, a thicker waistline, a more pronounced protruding abdomen, a torso with an apple shape, not to mention the stooped neck. That's all so awful. But the good news is we can help them with bone loss with vibration therapy. Our science-based med spa vibration therapy formula for menopausal bone loss, to be specific. And in this episode, we're going to give you the scoop as we walk you through the biological changes of menopause and detail the science-backed mechanisms of vibration therapy that restores a more youthful body by strengthening bones, correcting posture, and slimming the torso. So stay tuned.
You're listening to the Body Contouring Academy's Proven Profits podcast, where you'll learn simple, actionable strategies from real-world, successful body contouring professionals to help you generate more revenue, realize the profits you want, and create the life you desire. Hi, I'm Shannon.
And I'm Kay.
And we're your hosts of the Proven Profits podcast.
Hi there, healthcare professionals, business owners, body contouring technicians, and beauty professionals. Welcome, everyone. Kay here. Shannon and I want to thank you for being here, too. It's a fact. Women shrink in height at midlife and beyond. Menopausal bone loss, well, that's to blame. And let's face it, losing inches of height drastically changes a woman's body shape, not to mention the increased risk for fractures that are involved with this bone loss. As med spa owners, operators, we know firsthand the toll that menopause takes, or can take anyway, on a woman's body. For 20 years, we've used science-based therapies to assist women in fighting those changes. And one of those body-shaping treatments is our whole body vibration therapy formula for menopausal bone loss. It strengthens bones, it corrects posture, it slims the torso, and improves the overall shape of the body. All in just a few minutes a day for a few days a week. Sounds too good to be true, maybe, but in this episode, we'll show you it is true. We're going to walk you through the biological, the physiological, and the body shape changes of menopause. And we're going to detail the science-based mechanisms of vibration therapy, the ones that directly fight menopausal bone loss and deliver that improved and more youthful body shape. Now, menopausal women can build bone strength and improve their body shape, and they can do it in just a few minutes a day, a few days a week. Whole body vibration therapy is safe, effective, and easy. It's a way to help build and strengthen bones and improve the body shape. And the great thing about vibration therapy is it requires very little time and really zero effort, and women can do it even if they can't do other exercises due to limited mobility or pain. So that's it in a nutshell, but let's dive into the details. First, let's discuss the reasons why menopausal bone loss changes the shape of a woman's body. So what happens to a woman's bone during menopause? Couple of things. One, declining estrogen levels, and they lead to bone loss. These falling estrogen levels during menopause, how this happens is it disrupts the balance of bone formation and bone breakdown. And as a result of this, the bone breakdown outpaces bone formation, which leads to a significant loss of bone. Did you know that on average, menopausal women lose 25%, a quarter of their bone mass by the age of 60, just from menopause? And so the second way is there's really a high risk of fracture as a result of this bone loss. Menopausal bone loss can lead to a condition called osteoporosis. You've probably heard of it. It's the clinical term for reduced bone density and bone mass. Osteoporosis makes bones extremely susceptible to fractures, and it's super common. 80% of women develop osteoporosis, and approximately 50% of menopausal women, they experience a fracture related to the osteoporosis. Okay, so now you know what happens to bone during menopause and the health risks associated with it. Let's move on to what ways does this menopausal bone loss change the woman's body shape? Well, the first, it's a biggie, shrinking in height. So women shrink in height as a result of menopause due to both loss of bone mass and loss of bone density, which affects the spinal vertebra as it does all the other bones. The spinal vertebra, they become more compact, compressed, and even smaller. And so this shrinking in height really affects the woman's body shape in a bad way. So the major changes by the shrinking in height you're going to see is a thicker, shorter torso and a protruding abdomen. So menopausal bone loss leaves the torso of the body shorter and more compact, which leaves less room for the curves of a waist and that thicker waistline. Menopausal bone loss shortens the torso also, which results in a bigger bulging abdomen. It has less space to go up and down, so it goes out and protrudes more. And the compressed space in the trunk or torso also creates that famous apple-shaped torso that women complain about. Thinner arms and legs and a bigger torso. Okay, the second one is the stooping posture. The loss of bone in the spinal vertebra changes and compresses the spinal structure in the cervical spine and part of the thoracic spine, as well as all the spine. But these particular areas lead to a condition called kyphosis. Kyphosis is the clinical term we use to describe that stooping neck, that stooping posture that's commonly seen in postmenopausal women. And finally, third, muscle loss. Okay, so we're going to talk about how muscle loss exacerbates all of these changes because the health of muscle and bone, they're highly interconnected. And so that's how menopausal bone loss accelerates the muscle loss that's also associated with menopause and aging. So the menopausal muscle loss and muscle weakness increases and furthers both the thicker torso and protruding abdomen and the postural changes associating with that kyphosis or stooping posture. And this is like also awful, y'all, but there is good news. Menopausal women can both, one, prevent by starting early, and or to correct all these changes in body shape that are caused by menopausal bone loss. Our science-based med spa vibration therapy formula for bone loss, well, it works. But before we detail vibration therapy, that great treatment option, let's take a look at other available treatment options for menopausal bone loss. So what are they? Well, first of all, medical management. That's important. That personalized medical management. The decision between the menopausal woman and her physician. And that's because several long-term prescription medication options are available, as well as prescription hormonal options. And all of these meds can slow the progression of menopausal bone loss. So whether or not the woman wants to take any of these, knowing risks and benefits and her particular health issues with her personal physician, we're out of that. But that is available. Now, the second treatment option are DIY and lifestyle options for management of menopause, that bone loss that's related to it. So there are supplements. But first, just so you know, we're not going to be diving into the benefits or dosages of any of the supplements today because we just don't have time. Look for future podcast episodes where we'll cover these thoroughly. But to maintain bone health during menopause, women can consider supplementing vitamin D3 and vitamin K2. Time-released calcium, not just calcium, but time-released calcium. The body can only absorb so much calcium at a time for beneficial uses. And magnesium glycinate. Women should also eat a diet rich in bone-building nutrients. And as with supplements, we're not detailing any foods or nutrition today. You can look for that in future episodes. But to assist in maintaining bone health at any time really, and especially during menopause, women can consume foods rich in calcium, make sure there's adequate protein in the diet, and make sure to consume foods that contain vitamin D. And then exercise is another treatment option because that's to build bones and muscle. Remember that interrelationship during menopause. Women should consider incorporating weight-bearing exercises. These are exercises such as walking, dancing, jogging, those types of things. Strength training. Well, we know this as weightlifting, or you can even do it with resistance bands without weights. Balance exercises, and this is really important to prevent falls because remember that statistic, 80% have osteoporosis and 50% have a fracture. So you want to maintain balance during menopause and as you age. So consider Tai Chi or yoga, those kind of things. But you know what? Most women are missing and really should incorporate whole body vibration therapy, our formula for menopausal bone loss, which is the final treatment option category, technology. Vibration therapy addresses all of the issues associated with menopausal bone loss. Number one, it increases bone mass, it increases bone density. Number two, it builds, tones, and strengthens muscles. And number three, it even improves balance. It takes just a few minutes for a few days a week. Plus, women can do vibration therapy even if they have limited mobility or pain or difficulty with any other exercise. So how does our vibration therapy formula improve the shape of the body? Well, first let's review the basics. What is whole body vibration therapy anyway? Well, it's a passive exercise therapy that sends micro vibrations throughout the body, causing muscles to contract and relax throughout the entire body, and that leads to multiple benefits. We love vibration therapy, and one of the reasons is the enormous variety of benefits it delivers. Listen carefully to the benefits of whole body vibration therapy. Listen even more carefully to the first three that I'm going to mention. It builds bone mass and increases bone density. It strengthens and improves and builds muscles, and it improves balance. It improves circulation, reduces cellulite, improves flexibility. It promotes weight loss, improves cognitive function, promotes relaxation, and important for body contouring professionals, it improves lymphatic function. Now, maybe you're wondering how just one technology can do so much. Well, it all boils down to vibration therapy's mechanism of action, or mechanisms of action. Vibration therapy affects every system of the body, including bone and muscle, which is pertinent to today's discussion, all in a positive way. Now, as far as physiological benefits of vibration therapy, remember it improves bone density, bone mass, and bone strength. It strengthens and tones muscles, and it improves balance, as well as other benefits that lead to a better body shape. That's promoting weight loss. And that's how vibration therapy delivers an improved body shape. But let's go deeper and break the science and physiology down. Here is how it does it. 1. With force or gravity. That force produces a higher pull on the body. What this does is stimulates bones, improves bone density, improves bone mass, and strengthens bones. Now, the whole body vibration machine produces a vibrating side to side and back and forth motion, generating forces upon the body from 1G to 6Gs, depending on the amplitude and frequency of the settings in your machine. Now, by creating this safe and controlled mechanical stress on the body, it stimulates the bones to adapt and become denser and stronger. The second mechanism of action is muscle micro adjustments. What these do is strengthen muscle and improve balance. Now, when standing on the vibration therapy machine, every muscle in the body is forced to react in a continuous flow of micro adjustments, contracting and then relaxing rapidly, repeatedly, and reflexively. This can engage up to 98% of the muscle fibers in the body, producing huge rewards in just a short amount of time. It's the up and down motion, that third motion of vibrations, that improves muscle tone and strengthens muscle. And it's the side to side and front to back motion that improves the balance. 3 different vibrational motions, guys. Did you catch that? Okay, so the third mechanism of action of the vibration therapy machine is neuromuscular stimulation. And that's what provides the ability to produce all those multiple benefits. It's the rapid firing of the muscles that causes a super impactful neuromuscular response that flows throughout the entire body. Pretty cool, isn't it, y'all? Well, now you know how it delivers, but what kind of body shape improvements can you expect it to deliver when you're using it for menopausal bone loss? Well, you should expect a slimmer abdomen and torso. You should expect more feminine curves. And you should see a more erect posture and watch for better muscle tone and strength. And overall, a more youthful body shape. Are you excited about getting started? Well, we Surely hope so. And we're going to share the basic protocol for our vibration therapy formula for menopausal bone loss. But first, so you can better understand the steps in our protocol, let's talk about the 2 types of vibration therapy machines that you can choose from to use. There's 2 types: whole body vibration therapy platform and a whole body vibration therapy plate. So let's start with the platform first. These machines you stand on, and they have handles that come up for your hands to hold onto while you're using the machine. These types of machines are best suited for any professional setting because it's the safest for all types of patients. We use these machines in our med spa and always have, because we have patients of all ages, shapes, sizes, and abilities, and we feel it is the safest. Also, these are best suited for anyone who has balance or mobility issues, whether you're using it at home or in a professional setting. We've left a link in today's show notes that takes you to this particular vibration machine, and it's just like the ones we've used in our med spas for over 10 years, and we have 2 of them, and we keep them busy all day, every day. And we've done that for more than 10 years with these particular machines. So we'd say they're durable machines. So check out the link for the details. Might be for you. But the vibration therapy plate might be for you. That's the other type of machine. And it does not have fixed arms or handles. It does have detachable elastic ones that you can use if you want, but you don't have to. These machines are great for use by DIYers at home, and they're good for professional settings if they have all fit clients with really good balance, or for those professional settings where someone is accompanying their client at all times while they're on the vibration plate. Now, these machines are best suited for those who have limited space. They're small. They fit under a sofa, so you can pull them out to use and then slide them when you're done. Tuck them back into the sofa. And they're also good for those who are looking for a lower price point because they have the lower price point between the 2 machines. They're lower than a platform machine. And just like the platform machine, we've left a link in our show notes to a machine, and it's the very same vibration therapy machine that we, Shannon and I, own and use at home. By the way, we are both menopausal, postmenopausal. So check this machine out. It's very affordable. Now, let's get to the how-to of our vibration therapy formula for bone loss. How do you use it? Well, first of all, we recommend using vibration therapy a minimum of 3 times a week. But, if it's less than that, that's better than nothing. And since we've used this technology for so many years, you guessed it, we've developed several advanced techniques, but you can target menopausal bone loss and achieve an improved body shape with just these simple steps that I'm going to cover now. So the program setting. Always start, if it's the first time you're doing it, with program 1 and use it at that setting for at least the first 1 to 2 weeks. Now, you can advance to program 2 thereafter when you're ready, and this is highly variable based on your level of fitness or your patient's level of fitness, balance, and patient or your size. Now, we recommend not using program 3 for menopausal bone loss. Keep in mind, these machines are designed for all purposes and for people of all ages, fitness abilities, and goals. Now, what are the steps? Easy. Stand comfortably with your feet slightly wider apart than your shoulders. Turn the machine on and set your program. Now, programs run 10 to 15 minutes depending on the particular machine that you own or you use. That's it. Simple, right? And it's all you need to do. These are the very steps used by the majority of, nearly all of our med spa patients for years. But if you want more of a challenge, we'll give you some bonus advanced techniques here. So, number 1, and we're going to give you a total of 4 of them. So you can follow the steps that we just covered, but divide the time on your machine in half and stand with your feet as wide apart as possible during the second half. Now, if you're using a machine without handles, a plate, you may want to go ahead and take advantage of using the stretchable handles on this just to maintain your balance, or set your machine close to your sofa in case you lose your balance, you're falling onto a sofa. The second way is divide your time equally by 4. So what you're going to do in each of the fourths is first stand with your feet shoulder width apart, just like the normal protocol. Then your feet as wide apart as possible, just as in the first advanced technique. But you're going to add stand with one foot in front of the other, and then the other foot in front of the other for your other quarter times. Number 3, you're going to divide your time equally by 3. And what you're going to do on this is stand with your feet shoulder width apart, stand with one foot in front of the other, and then stand with the other foot in front of the other. Those are some options if you want to vary it up. But this one combines another therapy, our 4th one. You could wear a weighted vest during your vibration therapy workout session. Listen to the benefits of adding a weighted vest. It puts more stress on your bones for better bone building. It improves your posture by pulling your shoulders back. It helps you build muscle and strength, and it can burn up to 3 times more calories. So we've left a link in today's show note to the weighted vest that we like and use. You can check it out by going to the show notes. Now, when you do check it out, please note that you'll have options for various amounts of weight for that vest. We recommend using the lightest weight option, which is the 4 to 10 pound size. So it's not going to do you much better good using more weight than that. And remember, if any of these advanced techniques cause pain or cause discomfort or just don't feel right, you can use the regular protocol, and it does 100% of the work that these do. These just might work things a little harder. So what do you think? You've heard it all. Well, now it's time to purchase your vibration therapy machine and get started, right? So be sure and go and check out those machines, and you can take a look at that weighted vest too. But one more thing. For those body contouring professionals who are not yet certified in vibration therapy, or those who want to be body contouring professionals and are interested in getting certified in vibration therapy, we have a great vibration therapy body sculpting certification course. So if you're looking to earn your certification, take a look at the details of our whole body vibration therapy body sculpting certification course. It's very affordable, it's super quick to complete, and it's 100% online, just like all our other courses. So find the link in today's show notes, and that'll take you to the course details so you can check it out. So let's wrap up everything we covered today. And sorry, it's been kind of a lengthy episode, but there's been a lot to cover, because vibration therapy is the real answer for women who are facing body shape changes and menopause. And our formula makes it simple, science-based, and incredibly effective. So whether you're a professional looking to add this powerful tool to your business, or a DIYer ready to take charge of your own bone health and body shape at home, it's time to get started. So use our formula, follow these super easy steps, and watch what just a few minutes a day for 3 days a week can do. As always, thank you for being here. Until next time, beautiful wishes.
Are you ready to expand your business, boost your income, and enhance patient care and satisfaction effortlessly? Our game-changing online courses pave the way for seamless service expansion, all without a huge investment, endless research, or risky endeavors. Our courses provide comprehensive insights into cutting-edge technologies, step-by-step treatment protocols, downloadable resources, and more. After completing each course, you'll have the knowledge to deliver desired results and generate maximum revenue. Visit bodycontouringacademy.com, click on certification courses from the menu, and discover the courses that can transform your business today.